Welcome back to EMS Incident Command, where we share educational, officer development and leadership tips for EMS professionals as well as fire department members. In the field of EMS, paramedics, firefighters, and EMTs often find ourselves faced with challenging decisions that can greatly affect patient outcomes. One crucial decision that requires careful consideration is whether to employ a stay-and-play approach or a load-and-go strategy when managing an emergency situation. In this video, we will explore common factors that can influence this decision-making process. By understanding these factors, you can quickly make informed decisions that prioritize patient well-being while maintaining your own scene safety. Let's get started. Compromised scene safety. You must prioritize your own safety when responding to emergencies. If the scene is deemed unsafe due to environmental hazards, violence, or other factors that pose an immediate risk to you, the decision to adopt a load-and-go approach becomes paramount. In such cases, the primary goal should be to quickly move patients to a safer location, minimizing further harm to both the patients and the first responders. Timely transportation may be necessary to provide essential medical interventions while awaiting backup or specialized support. Contact online medical support when additional medical direction is needed. Follow your department and EMS region protocols. Multiple patients at the scene. At emergency scenes with multiple patients requiring immediate medical attention, the decision between stay and play or load and go becomes more complex. Assessing the severity and acuity of each patient's condition is crucial in determining the most appropriate course of action. Rapid triage and prioritization of care are essential. See the link at the end of this video for our SALT versus START triage video, where we discuss triage methods. For patients with life-threatening injuries or conditions, initiating immediate treatment at the scene and coordinating additional resources may be necessary. However, for less severe cases or when limited resources are available, transporting patients to the nearest and most appropriate medical facility could provide them with the timely care they need. Additional resources are needed. Certain emergencies may require specialized resources or expertise that are not readily available at the scene. In such instances, initiating a stay-and-play approach may be necessary to stabilize the patient and provide critical interventions until the required resources arrive. This approach allows for more comprehensive pre-hospital care and facilitates a smoother transition of care once the patient reaches the hospital. However, if delays in resource arrival jeopardize patient outcomes or there are imminent threats to responder safety, adopting a load-and-go approach may be the optimal choice. That decision should not be taken lightly, and your EMS region will either have protocols in place for situations like this or will require you contact online medical support for guidance on those critical transport decisions. Critical patient care conditions. Patients experiencing complex physical trauma are the definition for the load-and-go strategy. These patients need advanced medical interventions and surgery to survive. Time becomes a precious ally in these critical moments. However, a complete EMS assessment and critical interventions like tourniquets for bleeding control, long bone immobilization or airway stabilization should not be neglected on the scene. One critical condition that significantly affects the decision to stay and play or load and go is cardiac arrest. Cardiac arrest is a life-threatening event that requires the stay-and-play approach. The American Heart Association recommends high-quality CPR and early defibrillation in these cases, as it is vital for the patient's survival. Therefore, a stay-and-play approach is better for cardiac arrest patients. Initiating resuscitation measures, without delay, where the patient is found increases the likelihood of a successful resuscitation. It is better to stay on scene and continue ACLS resuscitation efforts until you get return of spontaneous circulation or to terminate the resuscitation attempt after completion of all protocols. As you respond to emergencies in the field, you will face numerous challenges when making critical patient care decisions. Understanding the factors that influence the choice between a stay-and-play or load-and-go approach is crucial for providing optimal care while prioritizing your safety and that of your patients. Remember, everyone goes home is the most important promise we make to each other at work. As an EMS leader, your team needs to know they can count on you to keep them safe, to provide quick and appropriate decision-making, and to ensure they have the resources they need to complete the mission and secure the scene with the best possible outcome. Your team will look to you for leadership. It is up to you to prepare yourself as a leader and to stay up to date on all of your department and EMS region protocols. To ensure smooth operations during any emergency situation, an EMS leader plays a crucial role in coordinating and managing the team effectively. First and foremost, the leader must ensure that clear communication channels are established, allowing for efficient information flow between all team members. This includes providing concise and timely updates, assigning roles and responsibilities, and maintaining open lines of communication with all first responders involved. The EMS leader should also foster a culture of teamwork, fostering mutual respect and collaboration among team members. Prioritizing ongoing training and education for your team is vital to ensure everyone is equipped with the necessary knowledge and skills. Additionally, EMS leaders should be consistent in their approach and establish standardized protocols and procedures. This will result in a seamless coordination during high-pressure situations. Regular drills, training and simulations can further enhance preparedness and improve team cohesion. Lastly, an effective EMS leader must prioritize the well-being of their team, ensuring proper rest and recovery periods, debriefing after critical incidents, and providing avenues for burnout support when needed. By demonstrating strong leadership, fostering effective communication, promoting teamwork, and prioritizing the team's well-being, an EMS leader can help ensure that emergency situations are managed smoothly and efficiently, leading to better patient outcomes and that very important promise we make to our team: everyone goes home. By carefully considering compromised scene safety, emergency scenes with multiple patients, resource allocation, critical patient care conditions, and your region's protocols for the treatment and transport of patients, EMS professionals can make informed decisions that lead to improved patient outcomes. Continuous training, ongoing education, and collaboration with medical direction are essential in equipping you with the knowledge and skills needed to navigate these challenging situations effectively. Together, we can ensure that every decision made in the field reflects our commitment to saving lives, providing the best possible care, and most importantly, keeping each other safe under any circumstances. Is there a topic you would like us to cover? Let us know in the comments. Please like and subscribe. Don't forget to hit the notification bell for more EMS educational videos. Until next time.